Hello and welcome to Passing Medications, ASCP's Medication Administration video series. In the next 15 minutes, we will review the correct technique for the administration of oral inhalers, eye drops and ointments, and transdermal patches. Oral inhalation therapy is used to treat respiratory conditions, such as COPD and asthma. Inhalation therapy can be administered using a metered dose inhaler, also known as an MDI, or it can be administered using a nebulizer machine. Common side effects associated with oral inhalation therapy include increased heart rate and nervousness. It is important to monitor for these side effects after administration. Each oral inhalant comes with a package insert that provides the latest product information. Prior to administering any oral inhalant, it is recommended the nurse review the package insert, paying special attention to black box warnings, side effects, interactions, and storage and administration procedures. Contact the physician or pharmacist with any questions or concerns. Once the nurse has referred to the package insert and addressed any questions, she can begin to prepare to administer a metered dose inhaler prescribed for Mrs. Casa by utilizing the same preparation standards employed for any other MedPass. For simplicity's sake, this video will stress the 5 basic rights, while covering other important aspects of medication administration, such as administering the right dosage form, giving the medication for the right reason, conducting the right assessment, and performing the documentation in the MAR. After hand hygiene, the medication administration record, or MAR, is checked for the oral inhalant due at this time. Using the pharmacy label against the MAR, each of the 5 rights, right person, right time, right medication, right dose, and right route, are checked prior to removing the inhaler from the medication cart, after removing the inhaler from the medication cart, and prior to placing the inhaler on a barrier. The barrier can be a clean tray or empty cup in which the medication and other supplies are carried into the resident's room. This provides a barrier between the supplies and the over-the-bed table or other surface on which the supplies are placed while the medication is administered. Keep in mind that if the inhaler is new and has not been opened, or it hasn't been used for several days, the inhaler may need to be primed. Priming simply means spraying the inhaler into the air a few times to ensure that medication is coming out and the device is working. Be sure to spray the inhaler away from the eyes and face. Specific priming procedures for each inhaler are included in the package insert. With the inhaler and gloves secured in the barrier, the nurse approaches Mrs. Casa. This facility requires gloves be worn during inhaler administration, but your facility may not. Be familiar with your facility policy.
Hello, Joanne.
Hi.
How are you today?
I'm fine, thank you.
Can you verify your last name for me?
Yes, it's Casa.
Okay. I have your inhaler for you.
Okay.
I noticed you were walking earlier. Did you have any shortness of breath?
A little, but it's much better than it used to be.
Oh, okay. Do you remember how to use the inhaler?
Yes, I'm supposed to breathe out, and when you count to 3, I believe, then I'm supposed to breathe, take a deep breath in.
Correct.
Right?
Yep.
Okay.
Okay. I'm going to count to 3. Open up. 1, 2, 3.
Mrs. Casa will hold her breath for as long as she can, 10 seconds ideally, to allow the medication to reach deep into her lungs. If a second puff of the same medication is prescribed, the nurse will wait at least 1 minute between puffs. Some medications require longer spacing, such as 2 minutes between puffs. Be sure to check the medication package insert for details. The nurse will continue to shake the inhalant as recommended by the manufacturer before repeating the same process for the second puff. If the medication was steroidal, Mrs. Concetta is asked to rinse her mouth with water and spit out. The inhaler mouthpiece is cleaned according to manufacturer recommendations or facility policy. Hands are then washed and the barrier is discarded. Returning to the medication cart, the inhalant is returned to the storage area, stored with the mouthpiece down, and the administration is documented in the MAR. What if a spacer device is used? Spacers, sometimes referred to as holding chambers, make it easier to coordinate steps when using an inhaler. The inhaler is shaken, as typically done prior to administration, then inserted into the flexible rubber end of the spacer. The resident breathes out, away from the spacer, then inserts the spacer mouthpiece into the mouth. The inhaler device is pressed once, and the resident takes a deep breath in, holding it as long as possible. Only one puff at a time can be sprayed into the spacer. Remember to clean the spacer frequently according to facility policy. When administering a discus-type inhalant, the same process applies, but remember, discus-type inhalers are not to be shaken. The discus is prepared for administration when the dose is drawn by sliding the dose meter. Once prepared, the discus is to remain in a horizontal position and presented to the resident for immediate inhalation. Clean a discus according to the manufacturer recommendations noted in the package insert. A few other pointers with discus inhalers. Don't let the resident exhale into the inhaler, and do not try to use spacer devices with discus inhalers. Also, do not slide the lever more than once per dose, and be sure the dose has been successfully received before closing the device. When administering either a metered dose inhaler or a discus inhaler, it is important to remember: instruct the resident to exhale prior to using the inhaler. This creates more room in the lungs for the inhaled medication. If using more than one inhaled medication, wait at least 1 minute between medications, or longer if possible. When administering steroidal inhalants, be prepared with water and an empty cup, and instruct the resident to rinse and spit after using the medication to remove residue. An easy way to identify whether a medication is steroidal is to look at the generic name of the medication. If it ends in "-one" or "-ide", it's likely a steroid. Double-check this information in a drug reference, or ask a pharmacist if you have any questions. The nurse follows the exact same process for the administration of eye drops and ointments. Again, after hand hygiene, she refers to the medication administration record and finds Mr. Hansen is due to receive eye drops. Checking the pharmacy label against the MAR, each of the 5 rights, right person, right time, right medication, right dose, and right route, are checked prior to removing the eye drops from the medication cart, after removing the eye drops from the medication cart, and prior to placing the eye drops on a barrier. With the eye drops and gloves secured on the barrier, our nurse approaches Mr. Hansen.
Hello, Jerry. How are you today?
Good.
Can you verify your last name for me?
Hanson.
I have your eye drops.
Oh, good.
Do you remember how to do this?
Yes, I tilt my head back.
Okay. I have tissue for you also.
Oh, okay.
There you go.
Thank you.
Okay, can you tilt your head back for me? Okay, I'm going to pull down your eyelid.
Repeat the same process in the other eye if ordered, while being certain to use a different gloved finger when applying pressure to the inner canthus to avoid any cross-contamination of the eyes. Pressing the tear duct located near the inner canthus or inner eye for 1 minute after each drop has been administered can reduce systemic effects throughout the body. Or as another option, the resident can gently close his or her eye for approximately 3 minutes after administration. If the resident has a suspected or active eye infection, Changing gloves between eyes may help reduce cross-contamination. Be sure to check your facility policy. After the last drop is administered, the bottle is recapped and returned to the box. The nurse provides Mr. Hansen tissues to wipe away any excess solution that may have streamed down the cheeks. Gloves are removed, hands washed, and the barrier is discarded prior to exiting the room. Returning to the medication cart, the eye drops are returned to the storage area and the administration is documented in the medication administration record. If the eye drop is a suspension, sometimes abbreviated as SUSP, shake the container well before administering the first drop. This ensures that each drop contains the correct amount of medication. If the resident blinks or the drop lands on the cheek, repeat the administration process to ensure the medication is actually received. If more than one drop of medication is to be administered in the same eye at the same time, either the same medication or a different medication, allow enough time between drops for the first drop to be optimally absorbed. With most medications, this means waiting 5 minutes between drops, while some medications specifically recommend waiting 10 minutes. Check the medication package insert or ask your pharmacist for specific information. If applying an eye ointment, the same process is followed. The resident is asked to lean the head back and look at the ceiling while the nurse gently pulls down on the lower lid and a strip of ointment is applied from the inner corner of the eye toward the outer. Be aware that eye ointments tend to blur vision. If a resident is scheduled for the application of an eye ointment just prior to events that may require functional vision, such as physical therapy or a favorite activity, ask the physician if the medication can be administered at bedtime instead. The application of topical patches that use the skin as the medium to absorb medication is known as transdermal medication administration. Two common transdermal medications include nitroglycerin and fentanyl. Our nurse prepares for the preparation of transdermal medication following the same model as practiced with all other medications, using the 5 rights and the triple check system. The nurse cleanses her hands and refers to the medication administration record to identify that it is time for Mrs. Manfrey's nicotine patch. She also notes the site the patch was last applied. Using the pharmacy label against the MAR, each of the 5 rights, right person, right time, right medication, right dose, and right route, are checked before removing the medication from the medication cart, before removing the patch from the package, and prior to placing the patch on a barrier. She ensures Mrs. Manfrey is in her room to provide a private setting. With the gloves, gauze for cleansing, and the patch secured on the barrier, our nurse approaches Mrs. Manfrey and verifies her identity by following the employer policy for resident identification in her facility. This facility requires gloves be worn during patch administration, but your facility may not. Be familiar with your facility policy. The nurse moistens the gauze, explains the procedure to Mrs. Manfrey, and applies gloves. If the previously applied patch is still in place, she removes it and folds the used patch in half, placing adhesive sides together. The area is cleansed with one of the plain water gauze to prevent any additional absorption of the medication. The site of the new patch is cleansed with the other clear water gauze and pat dried. Taking the patch out of its packaging, she dates and initials it, removes the adhesive backing, and applies the patch by holding it firmly in place for about 30 seconds to ensure an adhesive bond to the skin. The old patch is discarded according to your facility policy. Gloves are removed, hands washed, and the barrier is discarded prior to exiting the room. Returning to the medication cart, administration and new site location is documented in the medication administration record. Do not apply a patch to skin that is burned, cut, or has abrasions. Avoid exposure to heat. Do not allow the resident to use heating pads, electric blankets, or take hot baths while wearing any transdermal patch. Some patches are changed daily, some every 3 days, some once a week. So pay close attention to the prescriber's orders and directions for use. If a resident is scheduled to have an MRI, remove all patches prior to the scan, and remember to replace the patches after the scan. Be careful when opening the outer package containing the patch. If the patch is torn or cut in the process of opening, discard the patch according to facility policy and obtain a new patch. Always rotate application sites and date and initial patches before applying. We will conclude this program with review questions. The caregiver applies gentle pressure to the inner canthus of the eye to A. Prevent systemic absorption of the medication, or B. Prevent mixing of the medication and naturally produced tears. The correct answer is A. The inner canthus of the eye is a port of entry to the bloodstream, and gentle application of pressure to this area after the introduction of eye medication greatly reduces systemic absorption. Medication package inserts are included inside each oral inhalant, eye drop, eye ointment, and transdermal patch package. These inserts include A. Potential side effects and adverse reactions to the packaged medication. B. Known drug interactions with the packaged medication. C. Storage guidelines for the packaged medications. Or D. All of the above. The correct answer is D. Package inserts include vital information necessary for the nurse administering medication. The nurse is ultimately responsible for this knowledge. We hope the last 15 minutes provided helpful information. Should you have questions or require further clarifications, please see your presenter. And as always, thank you for your time.